Hello there, and welcome! If you've recently been diagnosed with a chronic lung condition, I want you to know you're in exactly the right place. We're going to spend the next few minutes walking through what pulmonary rehabilitation is all about, how it actually works, and most importantly, how it can help you take back control of your breathing and get back to living your life. So, let's dive right in. First things first, getting a diagnosis like chronic bronchitis, well, it can feel like a lot to handle. It is completely normal to feel worried, maybe a little scared, or just uncertain about what's next. So whatever you're feeling right now, please know that it's okay and it's completely understood. You might be thinking about things like losing your independence or worrying that your symptoms are just going to get worse over time. Maybe it's the fear of not being able to do the things you truly love, or just keeping up with your family and friends. These are the kinds of concerns we hear all the time. You are definitely not alone in feeling this way. But here's the thing. That feeling of uncertainty, it really starts to lift the moment you start to understand what's actually going on inside your body. Gaining that knowledge is so powerful, and it's truly the very first step toward taking back the controls. So here's our game plan for today. First, we're going to take a look at what's really happening inside your lungs. Then, we'll dive into exactly how pulmonary rehab is designed to help you breathe easier. And finally, we'll lay out a super clear, simple path for you to get started. All right, let's kick things off with Section 1, Understanding Your Lungs. We're about to clear up some of the mystery behind why you're feeling the way you do. So chronic bronchitis is really a disease of the airways. You can think of your airways as these tubes, kind of like highways for the air moving in and out of your lungs. And the main issue here is long-term inflammation along the lining of those highways. Now, that inflammation causes three big problems. First, the glands in your airways get swollen, and they just start producing way too much thick, sticky mucus. Second, the little tiny hairs, called cilia, their job is to act like a cleaning crew and sweep all that mucus out. Well, they get damaged and just can't do their job anymore. The whole cleaning system gets jammed. And third, the walls of those air tubes get swollen and thick, which leaves a lot less room for air to get through. And that right there, that's the key. It's this perfect storm of too much mucus, a cleaning system that's not working, and narrowed airways that causes that frustrating feeling of breathlessness and being so tired all the time. Your body is just having to work so much harder for every single breath. Okay, now for the really good part. Let's move on to Section 2 and talk about how rehab helps. Because this isn't just about general exercise. It's a very specific, targeted plan designed to fight back against those exact problems we just talked about. When it comes to chronic bronchitis, pulmonary rehab really zooms in on the number one problem, that mucus. Yeah, building up your strength and endurance is important for sure, but learning how to properly manage and clear your airways, that is the real game changer. One of the very first things you'll master is a technique called the huff cough. It's a much smarter way to clear your lungs. All you do is take a medium-sized breath in. Then you push the air out with your mouth open, making a huff sound, kind of like you're trying to fog up a mirror. It sounds simple, but it is incredibly effective at moving that stubborn mucus from the small, deep airways up to the larger ones where you can finally get it out.
And check out this comparison because this is so important. A regular, harsh cough is exhausting, and it can actually cause those small airways to squeeze shut, which traps the mucus down deep. The huff cough, on the other hand, is gentle, it's controlled, and it's designed to keep those airways propped open, making it way more effective.
You'll also learn how to use some really simple tools, like these oscillating PEP devices. When you breathe out through one of these, it does two amazing things at once. It creates just a little bit of back pressure that helps hold your airways open, and at the same time, it sends these gentle vibrations through your chest that help shake all that sticky mucus loose. So, what's this journey actually look like? Well, in your first week, you'll really focus on learning these key breathing techniques and starting some gentle, supervised exercises. By week 4, you're going to start noticing a real difference in your stamina and your confidence. And by the time you hit week 8, most of our patients tell us they feel so much stronger and way more in control of their day-to-day symptoms.
And the results, well, they speak for themselves. This chart shows what patients, people just like you, report after they finish the program. We're talking significant, real-world improvements in shortness of breath, in their ability to exercise, and just their overall quality of life. The numbers don't lie. This really works.
But what does that data actually feel like in real life? Well, before might be having to stop halfway up the stairs just to catch your breath. After is walking the dog around the block. It's the difference between feeling too tired to play with the grandkids and having the energy to actually keep up with them. It's trading that feeling of anxiety about leaving the house for a feeling of confidence and control. So you're probably thinking, okay, this sounds great, but how do I get there? Let's move to our final section, your path to getting started. We're going to make this as simple and clear as possible.
Honestly, it's as easy as 1, 2, 3. Step 1, just talk to your doctor, whether it's your lung specialist or your family doctor, and ask them for a referral to pulmonary rehab. Step 2, give us a call or hop on our website to schedule your first visit. And step 3, you'll come in for an initial evaluation with our team so we can get to know you and build a plan that's perfect for you.
And we know you've got practical questions too. It's really important for you to know that pulmonary rehab is a covered benefit for chronic bronchitis under Medicare and most private insurance plans. Our team takes care of all the insurance verification stuff for you, so that's one less thing for you to worry about. The bottom line is, you could be starting this journey to better breathing in just a few weeks.
As we wrap up, I just want to leave you with this one thought. Hundreds, literally hundreds of patients with your same condition have been sitting right where you are now, feeling all the things you might be feeling. They got better, and you can too.
If you take away just one thing from our time together, let it be this. You are not alone on this journey. There is a path forward, and there is an entire team of people ready to support you every single step of the way.
So I guess the only question left is for you. Are you ready to take that first step? That step towards breathing easier, regaining your independence, and just plain feeling like yourself again.
If the answer is yes, everything you need is right here. Give us a call or visit the website. We're here and we're ready to help you get started. Thank you so much for your time.